Welcome back to the Dr. America Show. I am your host, Dr. Sanjeev Sriram, and thank you for joining us. This is a very special Valentine's Day episode for you guys. We've been talking about love, we've been talking about broken hearts, and now we're going to be talking about HIV with our very special guest, Mr. George Kerr. Really excited to have him on. And before we bring him in, I just want to, do a little introduction so that you guys can get to know George and the amazing work that he does. So George is an award-winning public health activist, advocate, and senior administrator. He has worked on HIV, AIDS, and substance abuse treatment and prevention issues in underserved communities on the local, national, and international level for 20 years. Throughout those years, Kerr has served in management for the global profit FHI 360 and during his 8-year tenure as a decorated veteran of the United States Navy. As the founding executive director, Kerr has also led, developed, and coordinated services, resources, programs for such nonprofits as Syringe Treatment Advocacy Resources and Training, which spells START, at Westminster Presbyterian Church. And as a devoted community steward, Kerr has also served on the advisory boards for the DC Fights Back, the Washington Free Clinic, Federal AIDS Policy Partnership, the International Network of Religious Leaders Living with or Personally Affected by HIV/AIDS, and on the Places of Worship Steering Committee for the DC Department of Health. He has also contributed as a co-moderator for the Presbyterian AIDS Network, and as a longtime DC resident, George Kerr has engaged in these collective efforts as an openly gay, HIV-positive man of faith with deep spiritual and cultural roots in the DC, Maryland, and Virginia area. We're really excited to have George on the program. Thank you so much for joining us, sir.
Thank you for having me.
Oh, yeah. And, I'd like for our audience to hear your story and how you got involved with AIDS activism. If you don't mind, can you just tell us, how and when you got started and, what got you motivated for joining this important cause?
Sure. Thank you again for having me. Back in 1993, I had left the U.S. Navy and here where I worked for 8 years, and I went to work for a local organization that was doing international work, and that was called Family Health International at the time. And I actually ended up working there for 19 years. And so in 2004, I decided, well, this is not enough just to be helping people internationally. We need to bring it locally. So I started looking at what I could do, and so I just basically just started going to meetings, community meetings, and just listening. And then in 2005, I partnered with Alex Lawson, and we co-founded DC Fights Back. And it was an HIV/AIDS activist group, and we were really pushing the city to make them aware and to make changes within the city. And so I did that for about 5 years, and then in 2008, I said, well, I've done the activism work, and I've worked on it, so now it's time to be even more involved. And that's when I co-founded START at Westminster. And as you said, that was a syringe training advocacy resource and treatment. And what it is a harm reduction philosophy that we have started, and really motivated with the communities that needed more attention, the underserved, LGBT, people of color, people who were often left out of this discussion, people who really needed that voice.
Right, and I'm really impressed with that part of your story, because I do feel that we have communities that are in need of our compassion and our outreach, but we seem to have trouble really making that connection. And from what I've read and seen about AIDS in America, it looks like our country had such a really hard time just coming to terms with the fact that this is a challenge from biology, not morality. And despite the 1980s being a time of rapid technological growth, Americans did not widely accept that AIDS was due to a virus. What are some of the other challenges that you and the HIV/AIDS community has faced over these years?
I think that the biggest one, besides funding, of course, is the stigma that is associated with it. There's just too many times people are pointing and saying, those dirty people, or, you did something wrong, or even not even knowing the science about it. And I think that that's really true today, that we still don't know quite enough, or people that work on it on a daily basis know it, but I don't think the general public know the science that goes behind HIV and how it's contracted and how we can prevent it.
And I guess when it comes to this particular virus, what I find challenging is that it's not. We're now looking at a virus that has been, in our borders and part of our lives for, over 30 years. We're getting close to 40 years. And it's just striking to me that in an age with, so much technological advance, that we still have such trouble understanding this particular disease. Why do you think that is?
Well, I just think that let me just say this: we have come a long ways, and we made a lot of progression. But there's still the stigma that's involved with that, and so what we really need to do is increase our toolbox for prevention, and this includes educating the community. One of the biggest problems I see, besides the lack of funding, is the criminalization of HIV. Literally, people are being arrested for being HIV positive. And so there can be times when it's a simple he said or she said that they didn't tell me. In some cases, the virus is not even being transmitted. So I think just the basic science that is missing there.
Right.
And the medical treatment has gotten a lot easier. Back when I was infected, at one point in the early 90s, I was taking up to 27 pills a day.
Oh, wow.
And now they've got it down to where you can take it 1 pill a day. So, they've made it a lot easier, and the side effects is not as harsh as they used to be.
Okay.
But, once again, the price tag is very expensive.
Okay, and let's dig into that a little bit. So, we've got, some technological progress in terms of our biotechnology. And it's great that we're getting down from, 27 pills a day to 1. But, this issue of the cost, this is kind of where, this is like one of those fronts of the HIV struggle that is that it really does fall on socioeconomic lines. What do you feel the activist community has been successful with helping HIV patients overcome this hurdle?
Well, I think that making it Congress in particular aware that how important ADAP is, and that's the Drug Assistance Program.
Okay.
And even though we have the Affordable Care Act, that program is still extremely important because, like I said, the pills are very expensive. So, and then there's also, the medical side of it, but, when someone's HIV positive, it's not just the medicine they have to be worried about. There's the mental health, there's the housing, there's treating the whole person. So we really need to dive in and really start looking at really helping the whole person and to empower them. Right now, the direction that I'm seeing is that we're really paying attention to the care side, the medical side, but the other sides are lacking, and we really need more advocacy with that so that we can get additional funding.
Right. And that medical side gets completely undermined when we don't take care of some of these socioeconomic factors that, are very much a part of our brothers and sisters' health. And so, I want to come back for a second to what you were talking about before with regards to the stigma, because I've seen that in my own medical practice and my own career where, I've watched patients really, struggle with with the stigma and the shadow of HIV. And I was curious if you have any perspectives on how that stigma has changed. Like, where have there been improvements, and where do you see problems persisting?
Well, I think it's really on the individual level, and it's the individual that we have to really focus on, and in that community. The lower the socioeconomic is, the less education there is, the more apt there's stigma there. There are true champions that are out in the community, in the local communities, that are doing this work, but a lot of times they're not getting enough funding to do more of it. So really having to strive to get the prevention money out into that grassroots type of environment.
Right, so that it's actually customized and tailored to the local individual experience. I see what you're saying there.
It's really kind of peer-to-peer in some cases, or community health workers. Just, and sometimes, a lot that has is someone just needs to sit down and have a conversation.
Right.
And see what the individual concerns are.
Yeah, no, and you're absolutely right, because, somebody who's rooted in that neighborhood, who actually kind of, lives with all of the things that you were describing before about, about housing and, and the types of jobs that, communities have. I think that when the healthcare worker is actually invested personally in those communities in that way, and rises and falls with with their brothers and sisters, it actually makes for a much more personalized experience with counseling.
Correct. Yeah, I agree 100%.
So when it comes to I do feel that the stigma of HIV is a big factor when it comes to people not knowing that they are even infected. And what I find kind of, when we dig into some of the statistics even further, I was really struck by just how, disparate our communities are with their experience with HIV, because it looks like, we've got some really high rates among some communities in some regions of the country, and then we have not so high rates with other regions and other communities. And I was wondering if you could just sort of summarize and help us understand what's going on there with those disparities.
Sure. More than 1.2 million people in the United States are living with HIV, and that's what you quoted earlier. And that's as of 2011. That's the latest data that we have at this time. That's about almost 1 in 7, 14%, are unaware of their infection. And there's many, many reasons why people don't want to get to know their status. And I think one of the biggest things that we're fighting right now is the criminalization portion of it. HIV is the only, HIV and now hepatitis C are the only two medical diseases or viruses that you can get and be criminalized over. Everything else, there's no criminalization. So I think that has a lot to play with it. And then also, like we were saying, stigma has a lot to do with it. The HIV incidence, the new infection, the estimate incidence of HIV has remained stable overall in the recent year. It's about 50,000 new infections per year.
Wow.
Within the overall estimate, however, some small groups are affected more than others, and especially young men of color, the MSM community of color. And they are really the ones that's taking a big hit with this. So there needs to be more research and more attention to this population that needs to take place. By race, though, blacks and African Americans faces the most severe burden. And then injection drug uses represent about 8% of new infection in 2010 and about 15% in 2011. However, there is a federal ban on needle exchange, and so there is no funding from the CDC or NIH to really look at that as a prevention tool. And in D.C., before 2007, we had a federal restriction by Congress saying we couldn't use our local money. Then in 2008, when we started using it, from 2008 to 2012, we saw a drop by 80% of new infection rates.
Wow.
So that is a huge, huge number.
Yeah.
And so we need to work extra hard as activists to really get that federal ban lifted and to really put science back into and not morality.
Right. Yeah, no, because like there's such an impressive scientific evidence base for needle exchange and for a lot of what you're talking about, and it's tragic that the policy discussion is not being guided by the science, but is being guided by a misguided what I would describe as kind of a misguided mythology of morality.
Correct. However, I think we need to just keep putting a human face with the virus. If we have one person suffer, we have too many people suffering. So we know how to end this epidemic. We just now need to put the tools in the toolbox so that we can end it.
Yeah, so why don't we talk about some of those tools? I think that we've got some public health innovations which are, pretty, tried and tested, and they've withstood the test of time, so to speak. And then we have some new innovations, that are kind of more recent. And I was wondering if you have some thoughts or feelings about some of the old versus new ways of stopping HIV.
I think I don't want to call it old, but one of the biggest things that I think that we need is, now that we have treatment as a whole, we need the community to start talking about it more. We really stopped having these conversations, so we really need to push that. And so we need to keep pushing the conversations everywhere. And this is in the communities, in our churches, in our doctors' offices, everywhere that we can really push the conversation about how, if someone is negative, how to keep them negative, and if they are positive, how to get them virally suppressed so that they can it reduces the risk of them transferring the virus.
Right. So, you mentioned the faith community, and since you're very active in your church, I'm very active in my clinic. I'm actually curious about that that community's approach to talking about HIV in maybe some refreshing kind of ways, and in ways that the church community might not have heard before. So, can you tell us your experience with bringing these discussions to church?
Well, I could speak personally to my own church, and they were extremely open to the idea. How I started coming to this church was because I was coming to an activist meeting where we were bringing caravans across the United States to D.C. to protest for HIV and science base. And so when I first came to that first meeting, I was hooked, because this is very much a social justice church. There are other churches in the area that are having these conversations, but part of the problem also is there's not enough of them having the conversation. We need pastors speaking from the pulpit, and we need other, not just Christian. We need every faith community to really be talking about this. And how do we engage them? Every faith community has to be approached differently. So we need to have those conversations on how we can address some of these issues. Here at my church, we're able to put condoms in the church for people, and it's called Saving Lives Condom Distribution. But not everyone's going to be able to do that.
Right.
So we really just need every church to look at how far they can go and really start taking those steps, really stepping out of the box.
Yeah, and I think it's just like you said, it's this out of the box thinking that I feel will make a big difference for people's lives as we move forward on our experiences and struggles with HIV. But before we go, I'd really like to give you a chance to plug your organizations, because I feel like these groups are doing tremendous work, and I'd love for our audience to connect with to connect with your team and get more involved. So please take it away. Let us know what your groups are and how our listeners can participate.
Okay, just before I do that,
yeah.
I want to step back for just a second, because there was another point that I wanted to make about what we need to do, and that's really to be a voice, once again, to our local and national leaders. Politics plays such a big role, and so we really need the funding. The funding has been flatlined for so long that we really need to boost that up, because the epidemic is growing.
Mm-hmm.
So, and the cost of care is not growing. So we have more people with infection, but they're not getting the treatment. So we really need voices on Capitol Hill. Call your local city council members and really stress the importance for multi-levels of funding.
Absolutely, George. I totally agree. I think that basic level of civic engagement is probably one of our most critical steps for saving the lives of our brothers and sisters with HIV. And I'm assuming that your organizations are a big part of that. But I agree that we absolutely positively need to let our members of our Congress and state houses know that this needs to be a major priority in this fight.
Yes.
So please let us know how can our listeners get involved and join your join this amazing community.
Okay, we have a mobile unit that goes out to the community 3 days a week, and you can call our program director at 202-422-6396. Again, 202-422-6396 to find out the location for that van and go out and talk to our staff out there to see what needs to be taken care of. Or they can call the office here, 202-863-8450. Again, 202-863-8450. Or visit our website, www.startatwestminster, startatwestminster.org. And we can also be found on Facebook at Start at Westminster.
Okay, fantastic. George, thank you so much for joining us today. I felt this was a really productive discussion. I think it's given a lot of us a lot of food to think about, and given us some motivation for what needs to get done to help our fellow Americans with HIV. And I applaud your efforts, sir. Thank you so much.
Thank you again.
All right, everybody. So that concludes the HIV segment of the Dr. America's show's Valentine's Day special. I am your host, Dr. Sanjeev Sriram, on the We Act Radio Network. We're going to have some closing thoughts when we come back. Thank you so much for joining us.